On your website, you make the claim 75% decrease in post-concussion symptoms. How do you substantiate that?
That comes from these outcome studies that we've done where we've taken hundreds and hundreds of patients that have undergone treatment and compared their pre-treatment fMRI score and their post-treatment score. And what we see is typically there is at least a 75% improvement or decrease in that score from before treatment to after. And the lower the score, the better they feel, or the healthier that brain as far as that neurovascular coupling. Okay. Now, as far as subjective report, or what we call more of the qualitative report versus the quantitative, is that these patients are also reporting whether or not they're feeling better. And at the end of the week, patients report about a 65% decrease in overall symptoms. So 75% is more the objective fMRI statistical improvement, and 65% after that week is the patient themselves saying, hey, I feel about this much better. This is great for 1 week.
How do they substantiate 65% better?
So these scores are taken with something called a post-concussion symptom checklist. And so it's a self-report questionnaire that allows us to quantitatively track these numbers over time. And we can see that from the beginning of their treatment to the end of treatment, their scores usually drop by a significant amount. So for example, if someone was saying, I'm at 100 at the beginning of treatment, usually they're down to about 35 at the end of treatment. Like I said, they range from 75% to 65% improvement, right, with that first week. Now, with that being said, after about 3 to 6 weeks, most of our patients report feeling 90+% better. We're often the last resort. People that come to us have gone everywhere else and they feel hopeless, helpless. They feel dejected, worthless. They've been told often by their providers that there's nothing wrong with you, or now it's time to just suck it up, or your scans are normal, now it's just emotional. And that is all incorrect. But can you imagine at the beginning of the week, we have 14 to 16 patients that come here all feeling just like that. And to take these patients from helplessness and every minute of every hour of every therapy, empowering them just a little bit more and a little bit more and a little bit more. And I think that's really what, that along with the neuroplasticity, of course, is what helps these patients get that twinkle back in their eye and get that kind of hop back in their step, because they realize that brain injury doesn't have to define them anymore. It was something that happened to them, but not who they were, and not who they are now. And we just give them these tools to take their life back.
So on Fridays, we get to sit down with the patients and go over their results. We start the results on Monday talking about, okay, what we found. And sometimes that can be a scary day, but sometimes it can be a validating day too of, okay, there is something wrong. But then on Friday, we get to go over their progress. How has their brain changed? And how much better has it gotten in just a week? It's pretty cool.
The energy in the clinic starts to really liven up. Mondays and Tuesdays are usually hard days. All the patients struggle because we're pushing their brains so hard. Wednesdays can also be kind of hard, but when Thursday and it comes and Friday, there just seems to be this energy because brains are waking up. That plasticity's kicked on and kicked in, and you can see the lights in people's eyes.
I love that part. There's a new twinkle in their eye. Mm-hmm. Monday, we talk to them and they're just kind of a dullness. And then Friday, it's like, oh, there you are. It's so fun. But yeah, we love Fridays. In fact, I just talked to just a patient today about how I'm just loving their results because they had a pretty significant brain injury. And the results that they made was huge in just a week. So it's pretty cool.
As hopefully the last doctor that you'll have to talk to in this ongoing journey that you were put on, usually no fault of your own, that you were put on this horrific, journey. I'm here to say that with all of my 15 years of expertise, I have the ability to really listen to what's going on with you, to not discount any of your symptoms, and to take everything you're saying and apply that to what I know is objective, precise, precision imaging in medicine, and validate what you're going through. And not only can I validate that with imaging, but to be able to tell you, for all these other patients, it's worked. Why are you so different? I don't think you are. All these other patients have had 30 other doctors too. They just haven't gone to the right one. I understand you. I will help you. But it's not just intuition. It's using precision medicine and precision imaging to validate what you're going through and to help craft the perfect treatment for you. Without seeing the fMRI or the FNCI, you're not exactly sure which systems are overcompensating, which systems are overworking, which systems are pulling all the weight, and which systems are not. And so you might think, okay, my memory's not good, so I'm just going to keep working my hippocampus and my memory systems over and over and over and over. That might be actually detrimental, because if you were to do a scan, sometimes we see that your hippocampal memory systems are perfectly fine. But what if it's your thalamic or sensory processing areas? What if it's your attentional control areas that are usually the foundation, not usually, these are the foundational components to memory. And then what about executive functioning? So what if your executive functioning areas are not working well? Everything but memory, right, is not working well. If you're just trying to hit your memory, you're actually overworking a system that's doing okay or probably carrying more of the weight anyway, right? So it's important for us to know exactly which areas need to get that stimulation, which areas actually need to be calmed down. Prepare, activate, rest are the three main components that go into our treatment and how people get better as quickly as they do. So let's talk about prepare. So preparing is a way to activate the brain, usually through exercise, that gets the heart rate pumping, when your heart is pumping, it's infusing oxygen, right, into your blood, and that blood's going straight to your brain. Okay, so we need to get your brain prepared for all these changes. Next is activate, and that is like doing the actual exercise, a brain exercise. So for example, if we're having a difficulty with visual tracking, let's use that example again, and your superior colliculus is hypoactivated. We will do visual tracking exercises for you after we prepare you to get that neuroplasticity turned on so it can start adhering to these changes and being more able to have long-term results with these changes. The last piece is rest. And like Dr. Lowen said, when we sleep, that's when our brain assimilates all this information, we store our memories, we accommodate everything we've learned. Your brain also needs to rest and destimulate in order to absorb everything. Now, we won't put you to sleep, but we may do things like mindfulness or meditation or biofeedback or neurofeedback. And these are important ways for your brain to just calm down and take in everything that it's learned. And it's this cycle that goes on continuously all day, every day, and even multiple times during one particular therapy that can get your brain to change as quickly as it does. The PAR in and of itself is not the key. It's combining that with the imaging and knowing exactly which areas need it in which direction, right? Either hyper or hypo. So my fear is that people will say, oh, well, okay, all I got to do is prepare, activate, rest, prepare, activate, rest. It's like, that's not that simple either, because you need to know where to apply that and when. One example of prepare, activate, rest is a patient who one of our neuromuscular therapists might put them on a sprinting treadmill and maybe might have them do some high intensity kind of interval types of exercises to get that heart rate up. After maybe a few minutes of that, we would get them off the treadmill and we would take them into a cognitive therapy session where they might then have to focus on attention and maybe even verbal fluency, memory types of tasks. After about half an hour of that, that patient might be pretty tired, and we might put them in a de-stim room and have them do some mindfulness or some meditation. So that's just one example. But again, we have other examples where we may have them do jumping jacks in place to get their heart rate going, and then do some Dynavision or some processing speed tasks right there, and then have them rest for a couple minutes and then kind of start the process all over again.
So we definitely have this cycle that we use for treatment across all of our patients. And it might sound very simplistic. It's prepare, activate, rest. But within that, there is a ton of science backing as to why we chose that. Let's take the prepare stage, which is exercise. A lot of people exercise, but there are different types of exercise, and exercise can influence the brain directly and allow us to prime it in order to engage plasticity. We actually use different physical techniques in order to increase neurotrophic factors, basically the on signal for plasticity. The next thing we do is that when patients are going through this multimodal treatment, we're going for an integrative approach. I mean, let's take, working on that one muscle, on that one bicep. Well, one bicep does not an athlete make. When we're looking to rehabilitate an entire brain, it takes, conjunction. It takes therapists talking to other therapists. It takes an approach which, for example, we can use different visual exercises, which are visual systems back here, to work on prefrontal areas of the brain. The brain is at its core a network. It is a system. So our expertise, the therapist expertise, and all of them standing on top of that FNCI to do what they do allows us to get the outcomes that we do. On the science side as well, for example, a year ago or a little bit more, we didn't fully appreciate the influence of something called the autonomic nervous system for all of our patients. The autonomic nervous system, in brief, controls our fight or flight and our rest and digest balance. It's all of our automatic processes that go on in our body. A significant number of patients have dysautonomia. If we're talking about how successful we're going to be, the autonomic nervous system controls blood flow in the body. If the autonomic nervous system is affected in a patient, it's going to affect their outcomes. We implemented an autonomic nervous system protocol, and we've trained some of our therapists to work with it. Outcomes have gone through the roof. So that's how that science feeds back into what we do, all with that purpose of getting patients better.
And the last part of that, because she discussed prepare and activate, the last part was rest and destimulation, because there is an art and a science to resting that brain and knowing when that brain needs to take a break. Sometimes we can do it with some biofeedback. There might be some meditation, some mindfulness. It may also be some exercise in a way. So we however that body needs to destimulate, we can build that in. But that's a necessary component of that PAR, prepare, activate, rest.
It's the same thing as sleep. We consolidate memories when we sleep. We are trying to simulate a learning process. And that's how we can do it in sometimes 5 days. So the neurons need continuous oxygen in order for them to do their jobs. Anytime that there's that disconnect, that's where you get PCS, or post-concussion syndrome. What we do with that FNCI is we can see exactly what areas of the brain have that disconnect and then reconnect it.
So you're functionally able to see, because of trauma, where the brain is functioning well and where it's not functioning, and then you can target treatments to address those areas.
Exactly.
And it's really important for us to see whether or not those areas are hyperactivating or, in essence, guzzling gas and fuel versus hypoactivating, or, like we say, running on fumes. Because the way we treat those two different directions are very different. The first thing that really sets cognitive effects apart is our FNCI. That is our diagnostic imaging using functional MRI technology that does more than just diagnose, though. The most important thing it does is allow us to craft individualized treatment for these patients. These patients are usually struggling for weeks, months, sometimes years, and this can validate their injury, help us determine how severe it is, and help delineate exactly which treatments are appropriate for them.
When you actually get into the meat of the FNCI, we can essentially see in many cases where a symptom is directly coming from. For example, in visual systems, there can be a lot of visual changes after brain injury. One of the main areas that we look at on the FNCI is called the superior colliculus, which controls eye tracking movement. So we can sometimes see a direct correlation between the symptom and the neurological cause.
That also helps us guide that treatment specifically, because if we know that superior colliculus is hypoactivated or not getting enough blood flow, we will target our treatments to stimulate that area, to draw blood into that area. Almost like if you're trying to increase muscle mass in a bicep, you'd have to do some isolation exercises. Same thing, we can isolate different parts of the brain with these therapies.
Due to the fact that blood carries the cofactors that are essential for not only neurons to work, but for them to build a strong system. So, we have cells in our brain, but these cells can interact differently. Some connections are stronger, some connections are weaker. If we're looking to send blood flow to the superior colliculus, it's going to aid that area in not only doing its function, but to act as a part of a system. Think about vision. We've got our brain controlling our eyes. That's a lot of different areas of the brain that we may need to work on. The superior colliculus may just be one of those. The functional MRI and why we chose it is because, first of all, we can get very reliable detection in small areas of interest in the brain. We're talking brain areas the size of a lentil or smaller, and we can see neurovascular coupling in that specific area in the brain in real time. In addition, because functional MRI looks at neurovascular coupling, the vascular response to neurons and the oxygenation and deoxygenation in a specific area, we can look at both blood flow and neuronal activity versus something like, for example, SPECT, you may be looking at imaging of one cofactor of neuronal activity, but it's not going to give you that complete picture. We also see that as far as our outcomes, that fMRI is essential because of the database that we have. We have, at this point, hundreds of thousands of scans from healthy individuals and injured individuals. So simply our research base allows us to make very, very clear comparisons and trustworthy decisions when it comes to using that functional MRI for treatment.
The analogy that I like to use is that of the blindfolded men and the elephant. So you can have all these blindfolded men touching an elephant's tail or a tusk or the ear or the trunk, and they're asked to describe the elephant. And they're all going to have a different explanation for what the elephant is, right? The way I see it is with this precision medicine, with advanced functional neuroimaging, I can take off my blindfold, step back and say, it's not just the tail, it's not just the trunk, it's not just the tusk or the ear. This whole thing is the elephant, and we need to address it as a whole rather than individual parts. It's almost this gestalt feeling of that, the whole is greater than all the sum of the individual parts.
A lot of the treatments that I watched her do here, she's done before, but doing them here all together in the way that you did them together is what really made the difference. Could you speak to that? And because there are so many good clinics out there that maybe do the right things, but they don't really have the right recipe put together.
Yeah, so I'll try to summarize it in a couple of main components. So we definitely have this cycle that we use for treatment across all of our patients. And it might sound very simplistic. It's prepare, activate, rest. But within that, there is a ton of science backing as to why we chose that. Let's take the prepare stage, which is exercise. A lot of people exercise, but there are different types of exercise, and exercise can influence the brain directly and allow us to prime it in order to engage plasticity. We actually use different physical techniques in order to increase neurotrophic factors, basically the on signal for plasticity. The next thing we do is that when patients are going through this multimodal treatment, we're going for an integrative approach. Let's take, working on that one muscle, on that one bicep. Well, one bicep does not an athlete make. When we're looking to rehabilitate an entire brain, it takes, conjunction. It takes therapists talking to other therapists. It takes an approach which, for example, we can use different visual exercises, which are visual systems back here, to work on prefrontal areas of the brain. The brain is at its core a network. It is a system. So our expertise, the therapist expertise, and all of them standing on top of that FNCI to do what they do allows us to get the outcomes that we do. On the science side as well, for example, a year ago or a little bit more, we didn't fully appreciate the influence of something called the autonomic nervous system for all of our patients. The autonomic nervous system, in brief, controls our fight or flight and our rest and digest balance. It's all of our automatic processes that go on in our body. A significant number of patients have dysautonomia. If we're talking about how successful we're going to be, The autonomic nervous system controls blood flow in the body. If the autonomic nervous system is affected in a patient, it's going to affect their outcomes. We implemented an autonomic nervous system protocol, and we've trained some of our therapists to work with it. Outcomes have gone through the roof. So that's how that science feeds back into what we do, all with that purpose of getting patients better.
And the last part of that, because she discussed prepare and activate, the last part was rest and destimulation, because there is an art and a science to resting that brain and knowing when that brain needs to take a break. Sometimes we can do it with some biofeedback. There might be some meditation, some mindfulness. It may also be some exercise in a way. So we however that body needs to destimulate, we can build that in. But that's a necessary component of that PAR, prepare, activate, rest.
It's the same thing as sleep. I mean, we consolidate memories when we sleep. We are trying to simulate a learning process, and that's how we can do it in sometimes 5 days.
We have a team of PhDs, MDs, including neurosurgery, neuroradiology, sports medicine, family practice, neuropsychology PhDs, neuroscience PhDs, and we are just few members of a team of speech therapists, occupational therapists, cognitive therapists, neuromuscular therapists, physical therapists, psychologists, that all are experts in our field with regards to how to understand fMRI and relay that to treatment for that individual patient. And so to have a comprehensive team like we have, nobody else has that, along with all the science that backs us up. No, we're not able to treat 100% of the symptoms in 100% of the people at all. I wish I could. Like I said, they range from 75% to 65% improvement, right, with that first week. Now, with that being said, after about 3 to 6 weeks, most of our patients report feeling 90+% better. But that's after they've gone home after treatment, gone back to their lives, gone back to doing what they need to do. But even then, that's not 100%. So what are the issues that we tend to have a little more difficulty with? So even though we treat vision here, there are some patients that have really, really severe vision problems, and we would refer them outside of the clinic to continue some intensive vision care. Again, we are not a clinic that's set up for long-term care, right? But vision is one, but we have great resources for that. Another one is some endocrine issues. In fact, part of what we do here, I think what also makes us special, like I said, is this access to the medical community, and we have a whole bunch of doctors in-house that have different specialties, and one of them is endocrine. So we do blood panels. We're looking at different types of hormone changes, thyroid, pituitary issues that could be the result of the sequela, the after effects of a concussion, right, that often get ignored. So we'll take a look at that and see if there's anything else we can do with that area. But that also cannot get fixed in a week. And so, but we can at least give people tools to then continue some of their care. Another aspect that we don't treat in-house long-term is psychiatric conditions. Now, if someone's had long-standing psychiatric issues, we tend to make sure we ask if they're being followed by their own doctors, but often those people have significantly worse symptoms after a traumatic brain injury too, right? So we want to make sure that they get the care there, but that's not something that we treat per se. Now, if it's a patient that never struggled with psychological issues before, had a concussion, and now they're feeling depressed and anxious, but it's secondary to that concussion itself, that we can treat. We have psychologists here that can do more of this acute, kind of more short-term type of therapy, because it's more of a secondary factor to the injury versus more of a long-standing history of that. Those are the main, I think, problems that do not always get fixed in that 1 or 2 weeks with us.
But if someone comes here because of a concussion and they have some of those issues, you really can help to support them there.
I believe we can, yes. I think patients and data will show that too. All of the outcome data is actually published as well. And so we have ongoing science. And that science, not only do we try to contribute to the world, but we take that back into the clinic, and our clinic is evolving constantly. I mean, you have patients that have come through the program maybe more than once after a few years because they just really love it, and they'll say, this is a completely different program than it was before. Well, it's because science changes, right? And we can't just contribute to it without seeing what other people are contributing and then evolving and growing and learning from that.
Most of us that work here have either been through a brain injury or they know somebody who's been that. I've never had a brain injury, but being in the military, I've got many friends and family who I've seen suffer, but I've also had a brother who had a really bad brain injury. So, I'm on that family member side, and I'm a big advocate for the families. I see that it's not just them that suffer. When it's a brain injury, it's everybody around them that suffers as well. So we're here to help the entire family through that process too.
And don't you notice sometimes that the husbands, the mothers, the fathers, when they're accompanying the patients, you see their emotional roller coaster too, and as soon as that patient starts lighting up, the family member, the husband's like, I'm getting her back again, I can actually see her, or like I did in ROF this morning with a patient's mother who just was crying. She's like, I finally have my little girl back. And that's why we love Fridays, because that's when all this hard work pays off for the patient first and foremost, and for us. And we know that we are, we're not, no offense, right? But we're not just selling a widget or software or clothes. Like we are, it's helping people on their journey to healing and to finding themselves again.
And and the families too. We're helping the families as well. And I was a big skeptic starting working here. I really was. It took me a lot of research and a lot of time of just really understanding what's happening. Is this really true? And just watching the progress, it's real. It works. It's amazing.
Well, first of all, is the value. When you consider that you are getting a functional MRI, a structural MRI of your brain, a cervical MRI of your neck, a full week of treatment that includes about 6 months of treatment crammed into a week, and then a post fMRI, $9,900 is a steal for what you get. Part of the reason we can charge that is because we don't work with insurance companies. We'd have to charge a lot more if we had to do that. So once they realize what is all included in that and all the years of science that have gone into it, it's so easy to see the value, and it's easy for people to see, oh, okay, yes, I'm done. I can't tell you how many times, even just today, 3 times in the 3 patients I was working with today, that said, oh my gosh, I would pay anything. If I would have known, I would have paid anything to get to where I am right now. What is your life valued at, right? What is getting your child, your wife back valued at? Some people would say priceless. We say $9,900.